Good morning, good afternoon, my beautiful people. If you are coming across my video for the very first time, kindly like, share, subscribe to my YouTube channel, The Teeth Nurse, so that we can all learn together. I am Olayinka Nofisat Oyelowo, a registered dental nurse. This is our lesson 4, and on this lesson 4, we will be talking about tooth decay. Tí àwa Yorùbá máa ń pè ní akokoro. So I chose to discuss this topic because it's one of the major reasons for tooth loss. Ó wà ní ara àwọn nǹkan tó ṣe wípé ó jẹ́ kí àwọn èèyàn púpọ̀ kí ó pàdánù eyín. Kí ni à ń pè ní tooth decay? Tooth decay is the demineralization of the dental hard tissue. Look at this picture I'm holding. So bí eyín wa ṣe rí rè, this is how our tooth looks like in our mouth. This is the enamel, this is the dentin, and here is the pulp chamber, ibi tí ẹ̀mí eyín wà. Mineralization yẹn máa ń ṣẹlẹ̀ láti òkè. It happens from here. If you don't take any action, it progresses to this place. If we don't take any action, it progresses to this place and we start having pain. I will still explain how this occurs. There are 4 major factors that must be put in place before we can say I have tooth decay. Àwọn nǹkan mẹ́rin kan wà tó jẹ́ pé tí ẹyọ kan tí ó bá ṣe aláìsí ní àwọn nǹkan mẹ́rẹ̀ẹ̀rin a lè ní akokoro. The 4 things are: 1, you must have a tooth. Ẹni tó bá fẹ́ ní akokoro ó gbọ́dọ̀ ní eyín lẹ́nu. Number 2 is bacteria, kòkòrò àìfojúrí. Number 3 is sugary food àbí carbohydrate. And number 4 is time. Akokoro kì í ṣe nǹkan tó máa ń ṣẹlẹ̀ láàrin ọ̀sẹ̀ kan àbí ọ̀sẹ̀ méjì. It takes time before akokoro can occur. How does these 4 things that I just mentioned work together to progress to tooth decay? When we take our sugary food or carbohydrates, gbogbo wa la mọ̀ pé end product ti carbohydrate is sugar. So most of the time, it's not about you licking sugar. It is about you taking sticky foods such as bread, dodo, your candies, and all that. So when you take all this food that I have just mentioned, most of the time, they stick to the surface of our teeth. And once they stick to the surface of our teeth, the number 2 thing, which is bacteria, ẹ má gbàgbé pé wọ́n sọ pé a ní bacteria nínú ẹnu wa. This bacteria that is in our mouth, they will feed on those food particles. And when they feed on those food particles, they release acid. A máa rí pé táwa náà bá jẹ rice, tá jẹ wà, tá jẹ àwọn oúnjẹ wa, bẹ́ẹ̀ kọ́ la ṣe máa ń yà jáde padà as poo. So when those bacteria feed on those food particles, they will release acid, harmful toxins, and this acid and harmful toxins are the one that cause holes on our teeth over time. Having understood how these 4 major factors causes tooth decay, we will now go to signs that man notice before we can say, okay, I have tooth decay. Although it varies from one person to another, but generally I will just mention few of it. Number 1 is toothache. Yes, toothache, which could be mild, it could be moderate, and it could be severe. Number 2 is bad breath. That one is tooth sensitivity. Another one is noticing a gray, brown, or black spot on the surface of your teeth. If you have any of these signs I have just mentioned, you might be developing a tooth decay. So how can we prevent tooth decay? Number 1 is good oral hygiene. Brush morning and night. And when we are brushing, in our previous video I have shown us how to properly brush morning and night with a fluoride containing toothpaste. Number 2 is smart diet. Make sure your diet is low in sugar, and if you have to take all this sugary food, ensure that you brush afterward. If you are not with your toothbrush, rinse your mouth thoroughly after taking this food. 3 is hydration, taking enough water. After taking all your food, ensure that you take enough water and also use water to rinse out if there is any food particles in your mouth. By doing that, the water will take it out. Number 1 is flossing in between your teeth. The last one is visiting your dental clinic every 6 months. Some people don't even have all these signs I have just mentioned, but when they go for checkup in their dental facility, their dentist will be able to check all their teeth and tell them if they are developing a tooth decay or not. So let's move to treatment of tooth decay. Treatment of tooth decay varies depending on when you present at your dental facility. If you have a tooth decay on this surface, on this first layer, we can still put a filling. Your tooth can still be saved. If you report when the tooth decay is around this side, the dentin, we can still put a filling. But if you report when the tooth decay has already progressed to this chamber, which is the pulp, which is the life of the tooth, the treatment becomes more complex, and some people cannot afford the cost of treating it. That is why they have to remove the whole tooth. So that is the reason why visiting your dentist every 6 months will save you a lot. Have you learned something from this video? If yes, kindly share, like, follow me on my YouTube channel at The Teeth Nurse so that you can be updated when I drop another video. Bye.